The thoracic cage, also known as the rib cage, serves as a vital structural framework protecting critical organs like the heart and lungs. It plays an essential role in the respiratory process and provides support to the upper body. Understanding the anatomy of the ribs and the intercostal muscles is crucial for medical professionals as they are involved in various physiological processes and clinical conditions. In this video, we'll take an into-depth look at the anatomy of the thoracic cage, focusing on the ribs and intercostal muscles, their functions, and their clinical significance. The structure of the thoracic cage. The thoracic cage is made up of the ribs, the sternum, and the thoracic vertebrae. This bony framework encircles the thoracic cavity, which houses vital organs, including the heart and lungs. The ribs are connected to the thoracic vertebrae posteriorly, and most ribs are attached to the sternum by cartilage, forming the anterior part of the thoracic cage. There are 12 pairs of ribs which are categorized into three types: true ribs, false ribs, and floating ribs. True ribs 1 to 7. These ribs are attached directly to the sternum via their costal cartilages. False ribs 8 to 10. These ribs do not have a direct attachment to the sternum. Instead, their costal cartilages join the cartilage of the rib above them. Floating ribs 11 to 12. These ribs do not attach to the sternum at all and are free at their anterior ends. The ribs, structure and function. Each rib has a head, neck, body, and costal cartilage. The head of the rib articulates with the vertebral bodies at the costovertebral joint. The neck is a narrow area just below the head which leads to the body of the rib. The body is the longest part, and the costal cartilage at the anterior end connects the rib to the sternum or the cartilage of the rib above it. The ribs serve several crucial functions. First, they protect the heart, lungs, and major blood vessels from external trauma. Additionally, they assist in respiration by expanding and contracting the thoracic cavity. When the ribs elevate during inspiration, they increase the volume of the chest, creating negative pressure that allows air to enter the lungs. During exhalation, the ribs descend and the thoracic cavity volume decreases, helping to expel air from the lungs. Now that we've covered the structure of the ribs, let's turn our attention to the intercostal muscles and their essential role in respiration. Intercostal muscles. The intercostal muscles. These muscles are classified into three layers. External intercostal muscles. These muscles are the most superficial and are oriented in a downward and forward direction. Their primary function is to elevate the ribs during inspiration, increasing the volume of the thoracic cavity. Internal intercostal muscles. These muscles lie deep to the external intercostals and run in the opposite direction, from upward and forward to downward and backward. Their function is to depress the ribs during forced exhalation, aiding in the reduction of thoracic volume and expelling air from the lungs. Innermost intercostal muscles. These are the deepest layer of intercostal muscles and are separated by intercostal nerves and vessels. They assist the internal intercostal muscles in depressing the ribs during forced exhalation. With this understanding of the intercostal muscles, let's now take a look at the clinical relevance of thoracic cage anatomy. Clinical correlations. Rib fractures. Rib fractures can occur due to trauma such as a motor vehicle accident or a fall. These fractures can lead to severe pain, difficulty breathing, and even damage to internal organs like the lungs. In more severe cases, multiple rib fractures can result in flail chest, a condition where a segment of the rib cage moves independently from the rest, leading to ineffective respiration and requiring urgent medical attention. Pneumothorax, a pneumothorax or collapsed lung, occurs when air enters the pleural space between the lung and the chest wall, causing the lung to collapse. This can happen due to trauma, such as a rib fracture, or spontaneously in certain medical conditions. Understanding the anatomy of the thoracic cage is crucial for diagnosing and treating a pneumothorax, as physicians must know where to insert a chest tube to expand the lung and relieve pressure. Costal cartilage injuries. Injuries to the costal cartilage can occur due to trauma, and while these injuries may not always result in fractures, they can cause significant pain and limit the movement of the rib cage. Such injuries often mimic rib fractures, and clinical evaluation of the area, along with imaging studies, is necessary to differentiate the two. Thoracic outlet syndrome. This is a condition where the blood vessels or nerves between the collarbone and the first rib are compressed. Symptoms can include arm pain, numbness, or weakness in the upper limb. Understanding the relationship between the ribs, muscles, and blood vessels in the thoracic cage is essential for diagnosing and treating this syndrome. Key concepts. As we conclude this overview of the thoracic cage anatomy, let's review some of the key concepts. Rib structure. The ribs form the protective framework for the thoracic organs and are categorized into true, false, and floating ribs. Intercostal muscles. The three layers of intercostal muscles, external, internal, and innermost, are crucial for the mechanics of breathing and the stability of the thoracic cage. Clinical relevance. Rib injuries, pneumothorax, and costal cartilage injuries are common clinical conditions where an understanding of thoracic anatomy is essential for diagnosis and treatment. With these key concepts in mind, let's now reflect on how this knowledge can be applied in clinical practice and real to life scenarios. The thoracic cage is much more than just a skeletal structure. It plays a central role in protecting vital organs and facilitating respiration. Now, here's a question for you. A patient presents with difficulty breathing, localized pain over the left side of the chest, and a history of blunt trauma. On examination, you suspect a rib fracture. Which intercostal muscles might be involved in this case, and how would you proceed with further diagnostic steps? Let me know in the comments below. If you would like to watch my other lectures on topics like the lungs, kidneys, liver, brain, and eyes, visit my channel to view my other videos.